It's clear that this flu season is unlike any other we've seen in recent years. One thing we keep hearing over and over again is you need to get that flu shot. But is it too late? Here to answer those questions and more is Dr. Paul Nanda. Dr. Nanda is the Regional Medical Director for Hometown Urgent Care. Welcome, Dr. Nanda.
Thank you.
Great to have you with us. Now, let's talk, first of all, about the distinction that Ohio has compared with the rest of the country right now. Ohio has been declared in a widespread flu situation, not an emergency situation. What's the difference there?
There's a number of states, actually, that have an almost emergent condition that qualifies as an epidemic. So in Ohio, we are at epidemic proportions, which means that there's a danger to people right now in the public for getting the flu.
Everybody is saying, get that flu shot. You're saying it. Everybody you talk to who's in the medical profession is encouraging that. Why is it so important?
It's important because this is something that we can prevent most of the time. So all patients between the ages of 6 months and up should get the flu shot. They used to recommend different ages, but right now the recommendations for the Center of Disease Control recommends that all patients 6 months and older receive the flu shot.
So really, anybody who's up watching this program right now should go get a flu shot, right? It's not just people who might be at risk, but everyone out there, right?
Yeah, absolutely. Of course, there are people at higher risk, which they absolutely need the flu shot, but all patients should be having it.
I know a lot of people, Paul, they recommend, they sit back and they say, well, it's probably not really the flu. It might be something else. Talk about the importance of getting at the symptoms right away and getting to the treatment right away if you think you might have it.
So what's important to realize is the flu is different than other viruses like the rhinovirus or the Coxsackie virus, which can cause the common cold and other diseases. Influenza, when it hits, causes a pretty high fever of 101 or 102. It's very fast onset. It's not gradual like the common cold can be. It's also associated with a cough that's usually dry and sometimes upper respiratory symptoms and lots of body aches and soreness.
So the first step, obviously, is to get that shot. If you haven't gotten it and you feel it coming on, I mean, what's the first thing that should spark you to, hey, I better go treat this right now?
Usually if it's a sudden onset associated with a high fever, the importance is to get in to see your urgent care or your primary care provider within 48 hours of onset of symptoms, because we can use medications such as Tamiflu or antiviral medications to treat the flu, but only if treated within the first 48 hours.
And the bottom line is don't wait. Don't think, oh, I can deal with this. I'll drink orange juice or something. Just get the necessary medications in you, right?
Get in as quickly as possible because we can provide you with medications that decrease the severity and the symptoms. And we can also treat the symptoms as well to make you feel better while you get over it.
Yeah, which is key because some people say, I can't get out of bed even to deal with it. So let's get the medicine that you need. Hometown Urgent Care has everything on hand right now. There's no problem with that, right?
No, we have enough flu vaccine to go around. We have 6 locations in Columbus and 26 locations in the state.
And there you see exactly what Hometown Urgent Care has to offer. It's on the screen, and it really lays it all out there for people who feel like they might need to get some attention, or, as you recommend, everybody who should get attention, go and get it checked out right there. Talk a little bit about cost, how long you have to wait, that type of thing. People, want to know the particulars of it. So
right now we're running a special that we have the flu vaccine for $20 each. We're a walk-in clinic, so frequently at most of our clinics you'll be in and out in under a half hour, an hour. And we still see a peak in the flu season all the way till the end of February and into March. It's not too late to get the flu shot.
Well, and that's the other important thing to remember here is that we're just really at the beginning of this flu season. So if you feel like, oh, you know what, it's January, it doesn't do me any good now, that's not the case at all.
No, we saw a peak that was a little bit unusual this season in early December, and we expect that peak to continue through the end of March.
Why are we seeing this spike in this particular year? Is there any reason for it?
They think that one of the strains of the flu that's circulating right now is more virulent than the last few years. So the last time we saw this aggressive strain of flu was back in 2009 when we saw H1N1.
All right, we've had your information up on the screen. Dr. Nanda, thanks for being here, and hopefully we'll stem some of this off and get a handle on this whole deal, right?
Sounds good. I hope so.